Hi, this is your Sussex County chiropractor, Dr. Will Holdsworth from Pain Relief Chiropractic. I'm here with our intern today, Jenna. She is here today to get adjusted because her low back and her right hip have been bothering her for a couple years now. You're just kind of getting used to these things. Her mid back as well has been bothering her, and up into her neck, we noticed when we did a couple orthopedic tests that there's a little localized pain there as well. The hip and the low back and the mid back is a 3 out of 10, and we're going to see if we can get that lower today or completely resolved. When she did an extension of the back here, that caused like a 4 out of 10 in that same spot, so it exacerbated her chief complaint. So what we're going to do today is we're going to do a little bit of muscle work on the low back, the glutes, hamstrings. We're going to work on the mid back, the upper back, the rhomboids, and some of the shoulder muscles as well. We're going to do some work on our neck muscles, and we're going to adjust neck, mid back, low back. Sound good?
Sounds good.
All right, so we're going to start with you seated. You're going to face away from me. And what we're going to do is we're going to do a little bit of muscle work on the shoulders first. You're going to take your arm, and you're going to go from here across the chest, and you're going to grab this elbow and pull that in tight. Good. And we're going to go back out to the side where we were a second ago. Hold out, good, and go across the chest back and forth like that. Is the pressure okay?
Yeah.
Good, back and forth. So this is for her levator scapula muscle. We're loosening this one up because this muscle tends to get tight on a lot of people and can cause shoulder pain, neck pain. It travels from the shoulder to the neck. So we loosen this up to help with shoulder complaints, neck complaints, sometimes even headaches. Do a couple more. And one more here. Good, and relax. We're going to do that on the left, and over. Let me know if the pressure's okay again. And you've been to a chiropractor before, correct?
Yeah, I have.
How long ago was that?
Probably 6 months.
6 months ago.
Yeah.
And when you get adjusted, do they usually do the kind of adjusting that you've seen me do?
Not particularly.
Okay.
It's a little different.
Do you get the cracks and the pops and all that? You're used to that? Okay. Usually it's good to ask that question because some chiropractors, there's a lot of variety between chiropractors, which is both a blessing and kind of like not really a great thing also because it confuses the public as to what we do. Relax because of the variety, but also I like to see it as a positive because you can go to a chiropractor, raise your hand like you're asking a question, put that on the low back, like that, back and forth. You can just find a chiropractor that you like. You know, if you don't like those cracks and pops, you can go to a chiropractor who does more like exercise stuff. You can go to chiropractors who do more drop table and activator. If you like the cracks and the pops, you can come in here. We do have other ways to adjust the low back and the neck without cracking and popping, but most people tend to like the cracking and popping who come in here. If you like muscle work, same stuff. So it's kind of interesting. So the chiropractor you went to 6 months ago, how did they adjust you?
They did like massage
relax.
first, and then there was a lot of cracking and popping.
So was it massage like what I'm doing here, or was it different than
They
this?
actually had massage therapists as like part of their
Okay.
practice.
So you got a massage before you got adjusted.
Yeah.
How long did the massage last?
It was like 10 minutes.
10 minutes. Did you like it?
Yeah.
Yeah, relaxing.
Yeah.
Pressure's good here.
Yeah.
And one more. Good. And relax. We're going to tilt your head to the right and then tilt to the left. So we're going to go, yep, just rock back and forth. This is for our traps. Loosening these up too is important. Good. Couple more. And one more here. Good. Now we're going to go on your stomach. We're going to work on your low back.
Okay.
Face is going to go over there. Good. And we're just going to palpate the joints and see what's going on. You feel a little more locked on the left. Do you feel that?
Yeah.
Usually people are more locked on the right. That's sort of like a pattern that we tend to see, but definitely get some variety in here as well. So you're more on the left, we can work that out. This is for your glutes. The pressure okay here?
Yeah.
So this is really important to loosen these guys up. When we loosen these guys, it makes a big difference on the low back pain itself. And I'll show you some stretches. We actually filmed a couple of videos today on glute stretch, so you may remember that, Jenna. I don't know. But you can always do those stretches. It would be very helpful for this. Good. You have any questions so far?
No.
No.
I'm pretty good about talking it through.
Explaining it out.
Yeah.
I'll be honest, I do explain a lot more when I'm doing a video than when I don't do a video. Typically, just sort of talk about whatever's going on with the patient for the weekend or whatever, but it is good for the viewers to know what exactly I'm doing because they're interested apparently. You guys are still watching, so
Okay.
loosen this side as well. Is this pressure okay?
Yep.
Do you feel as though one side's tighter than the other?
The other side did feel tighter.
The left side's tighter too, and the musculature as well. Okay. And you're starting up at UConn soon, right?
Yeah.
So Jenna you went to Elon?
Yeah, North Carolina.
Elon, North Carolina for first year. Now she's transferring over to UConn, and you're a biomedical engineer.
Yeah.
Which is pretty neat.
Yeah, so this stuff is pretty cool.
You're gonna be way smarter than I am when you're done with that. That's for sure. Finish this out. Good. Okay. We're gonna loosen these muscles here. These muscles are important to get after for people who are complaining of an area between their shoulder blades. Does this give you any headaches at all? You having any headaches
Not
today?
really, no.
Pressure's good here?
Yeah.
Do you have a foam roller?
Not at home now.
No. You know what they are though, right?
Yeah. My friend has them.
Is your friend working out a lot?
Yeah.
Do they work out at a gym or are they working out at home?
Martial arts studio.
Martial arts studio.
Yeah. My studio has them, so I can just take it from there.
Oh, you go to martial arts too?
Yeah, I haven't since I've been back from school, but
What do you, what kind of martial arts is it?
I did Krav Maga for the first time over winter break, but I've done Hapkido before that.
Hakio?
Hapkido?
Hakido. That's what I would say, but
Yeah.
Well, how do you pronounce it actually?
It's like Aikido, but with
Aikido.
hop.
Okay. Pressure's good here?
Mm-hmm.
And we're loosening up this muscle as well, the infraspinatus. Another important muscle to get after. Good. Okay. So now we're going to adjust Jenna's mid-back. Finding spots that are tight. Go ahead and breathe in and breathe out. Good. I'm going to breathe in and out here. Good. And one more in and then out. Good. Let's get the top. Breathe in and out. Good. Let's go on your back, face up. We'll bend this knee. Good. And take your arms, we're going to cross here. rotate toward me from here and let this leg drop this way. Good. We're going to breathe in and then breathe out. Good. We'll go flat on your back. It's the right hip, so I'm going to adjust your hip before we do your low back on this side. So relax this leg and let it go heavy. Good. Bend this knee. We're going to switch your grip a little bit. Perfect. A little more toward me. Good. And we're going to breathe in and then out. All the way. Good. Good. Go flat on your back. We'll relax this here. So are you planning on doing martial arts this summer?
Yeah, I want to. I need to make a little bit of money first before I can go back though.
Oh, they're charging you?
It's not free.
It's not free. How much do they charge?
Like 80 a month, depending.
80 a month?
If I go back to the same place or not.
Okay. And where is this place?
If I want to do Krav Maga, it's out in Rockaway.
Okay.
But if I want to do Hokkaido, it's over by Kittatinny.
Okay.
Yeah, my best friend's dad owns it.
Relax that. We're gonna adjust your wrist there. Is there pain with that?
A little bit, yeah.
Have you injured this wrist before?
Not that I know of. No.
Not that you know of. Okay. Relax this. We got a lot of motion on them. There's usually no discomfort with your wrist, but we did talk before that you get a little bit of numbness and tingling in your hands.
Yeah.
So that may have been why. We're gonna loosen up the muscles here. Got some louder audibles than usual. Usually it's like a very soft, but that was pretty good. Relax this here. We're just doing the muscle work. Good.
Yeah.
You'll feel your wrists a lot looser now after that.
Yeah. When I was in 7th or 8th grade, it was like a cheerleading accident, like landed on my neck.
Okay.
That's what like started it.
Did you get x-rays for it?
Pretty sure. I honestly don't remember. It was a while ago.
What'd you do after you fell? Did you get like,
I mean,
did you go to the doctor?
I went to the hospital.
And what'd they do for you there?
I don't remember.
Did you have to
I
stay
think
overnight?
I had not overnight, no, but I definitely had a CAT scan. I think I went back for an MRI at some point.
Okay. And you don't remember them telling you had a fracture in your neck or anything?
I didn't.
Okay. You didn't have one? For
Yeah.
sure. Okay. Well, the one thing you really want to make sure you do before you work on anybody is do an exam. We did an exam before we did the adjustment here today with Jenna, as we do with all of our patients. But it's really important to ask these questions. I was telling Jenna and Craig, who's filming, that we have to get 80% of the diagnosis is derived from just asking questions. So just asking questions alone is really important. Those questions that I asked Jenna a second ago, did you fracture your neck? That's a contraindication for giving someone a neck adjustment. You don't want to adjust someone who's already fractured their neck before. There could be some instability there. So relax your wrists. Good. See how that felt? That's usually how it feels. But that right side really wanted to move. Yeah. We'll loosen this up here. Relax your elbow. Good. Good. So if you had a choice between Kittatinny or Rockaway, where would you go?
Kittatinny.
Kittatinny, because
Yeah.
it's closer, right?
And it's my best friend's dad. It's his
Right.
studio, so I'd like be with all my friends there.
Okay, cool. And that one's 80 a month?
That one's more expensive.
How much is that?
It's like 130 a month, I think, but he might give me a deal if I.
They might give you a deal?
Yeah.
There you go. Always good to get deals.
Yeah.
And we're working on our subscapularis muscle here. Loosening this up. Good. Okay, we're going to adjust your shoulder. Relax this. Let it go heavy. Good. Hand on your cheek. And breathe in. And then breathe out. Good. That was easy. And get this side here. Relax this down. Good. And hand on your cheek there. Breathe in and then out. Good. That first shoulder move where I swing it across your chest, that's another one, like the wrist, where it can like pop and people get some temporary discomfort, but it feels good afterwards. Similar to that wrist there. Alright, we're going to loosen these muscles up first. No adjusting yet. Pressure's okay?
Mm-hmm.
The muscles I'm working on right now are just beneath her skull. And these muscles, when they're tight, are a big cause of tension type headaches. There's multiple different types of headaches, and one of the headaches that we work on as chiropractors is tension type headaches. So loosening these muscles up really helps with headaches and not just neck pain. Relax your head here. Good. Now we're just going to check your range of motion. No adjusting it. We're going to go to this side and then this side. Relax your head. Go that far. That far. So you see how you go really far that way?
Yeah.
But then this side we just stop.
Oh yeah.
So what that means is we need to adjust like right in here, which may be sore. Is that tender at all?
Yeah, a little bit.
And then we go to this side, same level. Is it sore on this side?
Not really.
But this side is more.
Yeah, it's deeper.
Okay. So what we want to do is adjust that. When we adjust you, when we put you in this position here, do you see how it's encouraging that motion you're restricted in?
Yeah.
So we relax this here, we go real light, and that's all it is. And you get that loud crack because it's so close to your ears.
Yeah.
So now we check again. Still go a lot further. So we have another spot down in here. We're doing the lower part of your neck because the lower part of your neck does more lateral flexion. The upper part of the neck does the rotation. Relax this again. Good, and one more. Okay. Now we'll check rotation again. And you're a little tight that side. Relax your head. We'll do one more. Good. Now we'll check your range of motion. Not far. And you go a ton more that way. That's something that we can't really fix there. But you're even both those sides, so that's good. Let's come on up and see how you're doing. Let's do that test where you lean backward. Stand up and lean back.
Doesn't hurt?
At all?
No.
Good. Okay, and then how's that spot between your shoulder blades?
It feels good now.
Is there any pain there at all?
No.
When you move your wrists, how do they feel?
They feel good.
Good. You can do this all day now? Good. Alright, so that's an adjustment here. This was the first time I've adjusted Jenna. So maybe a little different than the last adjustment you've gotten. We did your shoulders today, which I don't know if you've gotten that before. Your wrists were new to you, obviously.
Yeah.
The hip was new. So we do more than just the neck and the back. We'll also work on the extremities as well. Do you have any questions for me?
No.
Well, that's it for us. This was Jenna, our new intern. I'm Dr. Will. Craig on the camera there, if you want to wave at the camera there, Craig. Thanks so much for watching from Pain Relief Chiropractic, your Sussex County chiropractor. Have a good day.